Hi there, my name's Danielle Rankley, a program coordinator with the Upper Midwest Telehealth Resource Center. Thank you for attending this session of the Upper Midwest Telehealth Resource Center's Telehealth Bootcamp series. This series is being presented in collaboration with the University of Mississippi Medical Center's Center for Telehealth and the Ohio State Office of Rural Health. We're excited to be able to provide you with access to this incredible series, previously closed to the 2026 Telehealth Bootcamp applicants only. If you have more questions about telehealth or want to know more about the Upper Midwest Telehealth Resource Center, please come visit us on our website at umtrc.org. You can peruse our library of resources, check out our blog and podcast, and contact us to receive up to 10 hours of free telehealth technical assistance per year. Thank you again for joining us. Let's get started.
All right. Good afternoon, everyone. I guess it could be morning, wherever you are. But thank you for joining our first webinar that is a part of our Telehealth Implementation Bootcamp with the focus on chronic disease management. My name is Tierney Davis, and I am the Director of Clinical Programs and Strategy at the University of Mississippi Medical Center, Center for Telehealth and Emerging Technologies. I keep forgetting to add that last little bit to it after our recent name change. Our Center for Telehealth is also a National Center of Excellence in Telehealth as designated by HRSA. We are very proud of that and the work that we are doing. I will not spend a lot of time on this introduction, but I do feel like it is important that we share the reason why we are doing this. This is our second cohort of the Telehealth Implementation Bootcamp, and we are super excited to have more of a focus in telehealth this time around. So we know that, everything that is going on in the nation, within our respective states, and local communities. And I think we all share the idea that there is a need for us to address chronic disease management more intently and more innovatively. So thank you for coming. We all have a shared purpose for strengthening how we design, deliver, and sustain care for individuals living with chronic disease. Across the country, and particularly in rural and underserved communities, we continue to see the growing impact of chronic conditions, such as diabetes, hypertension, heart failure, and behavioral health disorders. Traditional care models alone are no longer sufficient to meet the complexity, scale, and continuity of care that these patients require. We are being called to innovate, not for innovation's sake. So that's not to say we are innovative, but to actually close gaps in access, improve outcomes, reduce avoidable utilization, and support patients where they live, work, and heal. So this is why we're here. The purpose of this bootcamp is to move beyond theory into practical, actionable strategy. Over the course of our time together, you will explore scalable telehealth models that strengthen chronic disease management, identify operational, clinical, and regulatory considerations for implementation, learn from real-world use cases and peer experiences, and develop or refine an implementation roadmap tailored to your setting. We hope that you not only leave inspired, but equipped with concrete tools, frameworks, and next steps that you can take back to your organizations. Welcome to this bootcamp, and let's get started. Shawn Nason will be presenting today. He is a nationally recognized healthcare innovator, strategist, and speaker, known for his human-centered innovation and digital transformation in healthcare. I'll let Shawn share more about himself. Without further ado, I'll pass it on to Shawn Nason.
Hey everybody, I'm so glad to be here. Hopefully none of you are up in the Northeast and completely snowed in. Oh, I see some people raising their hands. Yeah, we still got a little bit of snow here. I am based in Cincinnati, Ohio, so it is great to be here. And today, to start off the boot camp, one of the things we have done the past couple of years is talk about trends and keeping the future as human here. So Today, we're going to actually look at 10 consumer trends that are reshaping healthcare by 2030. As Tiffany mentioned, I do have the chat opened. So if you do have a question and you can't remember it until the end, please put it in the chat and I will make sure to get to them as well because I want to make sure that everybody's gets answered and you guys get what you need here today. So, without further ado, I am actually going to jump in and tell you a little bit about myself. I am Shawn Nason, the founder and CEO of Nason Group. And I put my 8-second elevator pitch into I'm what happens when a musician and a pastor becomes a Walt Disney Imagineer and then turns into a chief experience officer, author, and founder before getting and beating cancer twice, and then ends up being a healthcare executive to help change the world. So a few of the pictures here, just to let you know a little bit about myself. As I mentioned, live in Cincinnati, Ohio. You will see my family up there in the top left. That is my wife, Carla, my daughter, Kayla, and my son, Colby. And to give you a little bit of history about our family, so you understand why healthcare is even more passionate. Both of our children are adopted, and Kayla deals with anxiety and ADHD. And then Colby, he is our little man who you may actually hear, or he may even show up sometime today too. He may walk by here because he's not at school today. Colby is on the spectrum and also has epilepsy. So we use telehealth a lot in his care. My top right picture there is actually when I was going through some infusion. And you'll see my friend Groot there on my shoulder. And you'll see many Groots behind me because, as I mentioned, I worked for the Walt Disney Company and was a Walt Disney Imagineer. And you'll see down in the bottom right, we love to do Disney cruises. And that was actually Halloween 2 years ago when we were on the cruise. So why this matters and why this boot camp matters and why healthcare matters is that healthcare saved my life, but it didn't always see me. And I want you to understand and let that statement come into you that this is actually what many consumers say. And I can tell you as well from my personal journey that yes, healthcare, my clinicians saved my life, but sometimes during my cancer journey, they didn't always see me as a human. I was either a number or I was just the next patient, but I didn't always felt seen. And this came out of the Barrel Institute in 2024, where it talked about the state of patient experience. So keep that in mind as we go through these next 3 months that people, yes, we're saving lives, but people want to be seen. So why consumer trends matter in healthcare? 60% of patients today would switch providers for a better digital experience. So think about that. 60% of patients would switch who they currently see today if they had a better digital experience. And this just came out this week that 23% of US adults said they use AI as a source of medical advice. And I will give you my personal story even around AI and what that means to me. When I was re-diagnosed in my reoccurrence of colon cancer, I had stage 3 colon cancer, went through treatment and couldn't figure out why radiation and oral chemo did not knock it out. They started wanting to explore clinical trials with me and being working in healthcare for so long. I have a pretty good network. And so I went to MSK, I was at Mayo, I've been to Hopkins, Cleveland Clinic here in Ohio, the James in Ohio. And so we couldn't figure out what was going on, and I was getting frustrated as a patient and going back to that statement that healthcare saved my life, but I didn't feel like sometimes I was being seen. I, with a friend of mine, spent about an hour taking and creating an AI chatbot. And then I took all of my medical records, all my pathology reports, everything, and dumped them in and asked for what they thought was going on in me. And within 2 minutes, it had said yes, that I had colorectal cancer, but additionally, I had a disease called small node-based metastatic disease. And that is where I have cancerous cells that lie dormant in my lymph nodes and sometimes activate. And so we have to track what's called ctDNA in me, but no doctor had even found that or mentioned that. And within 2 minutes, I got that through AI, went back to my review board and said, I think I have this. And lo and behold, they all were like, yes, you do. So, is AI real? It is no longer a tool in healthcare. It is diagnosing. There's reports coming out every day around the state of AI and healthcare and what it means. And so, what does that mean in telehealth? It means a lot because people are already self-diagnosing. They're not going to the doctor. And as well, they probably are getting some misinformation at the same time. So, trend number one, trust becomes a competitive moat. So this is a study that comes from McKinsey and Company as well that was just released at the beginning of February of 2026. Patients today expect transparency, clear communication, and reliable experiences. So let's break that down. What does transparency mean? I don't know about any of you, but if you have gone through any type, and we're talking about chronic conditions and chronic diseases here, many times the system is not built to talk in clear transparency to patients. And so going back to AI and digital tools, I could not read pathology reports correctly. I could not read PET scans correctly. I could not do all of that, but I found a tool that could bring complete transparency in my journey. Patients want clear communication. We don't want to be talked to anymore in jargon and medical language. They want clear communication. And most importantly, they want a reliable experience. And again, when you think about in my situation in a cancer journey, excuse me, that every time I go into the infusion suite, every time I go to see my oncologist or walk into the practice at University of Cincinnati, I want a reliable experience. That's how trust is built. And if consumers don't feel trust, they will go someplace else. I can actually, again, give you a perfect example. I was actually fired by my first oncologist. I didn't fire him. He fired me because I put so many expectations on them. And he was like, you know what? I think you better go someplace else. So, trend number two, care anywhere and everywhere. This is totally right in the wheelhouse that many of you guys are exploring or doing today. Virtual care and in-home care options are rapidly growing. I'll use my personal patient journey as we walk through this. After I had surgery on my last tumor to have it removed, and I had to have a stoma put in and a colostomy bag, I wanted to go home. And I knew that my care would be better laying in my bed here in my house than in a hospital. Within 12 hours of completing surgery, my doctors dismissed me to my home. And I know that for me, recuperating was better here. So that's the concept of hospital at home. That programs reduce, hospital home programs reduce admissions by 30%. Mercy Virtual is a new, has been around for a couple of years, but a new thing where they're like hospital without beds. This whole concept of how can you keep people at their home. And again, the impact around this care anywhere and everywhere is reduced hospital readmissions by 35%. And this was in 2023 when McKinsey released this report. I have not seen a new report or an update on this, but I can probably say that numbers have risen. Trend number 3, the digital front door becomes table stakes. Consumers expect modern digital entry points. This is from a survey that Accenture Digital Health Consumers did in 2024. Again, it's even more. And that we're talking about remember, what to expect in healthcare by 2030 and what consumers are leaning to. The first statistic I gave you today is around, I told you 60% of patients would change their provider for a better digital experience. I'll give you some of my personal example on this as well from my journey. When I needed to go get second opinions, and I went to every one of those different hospitals associations or systems, I had to create a new MyChart account for every hospital, and I had to download all of my records for every hospital. So today I have a spreadsheet, I think, that I have 9 different MyChart accounts. And if I get an updated test and I want someone to look at it, I have to go and put it in each of those. That is not a great digital front door experience. So when you're thinking about telehealth, you have to think, I tell people all the time, if your experience isn't as good as this experience, then you're not meeting table stakes. 80% of what we do today in America, we do right here. I don't know how about any of you. I can't see your face, so I can't make you raise your hands here. But I don't know when the last time you walked into a bank to make a deposit or talk to a banker, right? We can do everything here. We can digitally deposit. We can, we don't have to go to the grocery store anymore, right? You can order your groceries and they deliver to your house. Everything we can do through that. So your digital front door experience absolutely has to be table stakes as you move forward. Personalization at scale. That's trend number 4. AI and analytics enable personalization, but it must move engagement. So let that one sink in. AI and analytics enable personalization, but it must move engagement. And so I work with a lot of C-suites and talk a lot with a lot of C-suites around where should AI be implemented in healthcare? And I tell them, not at the low-hanging fruit situation. So many times, matter of fact, I'll give you my prime example today. I am trying to call my local hospital system, Mercy Health System here, to get a CAT scan scheduled. And I spent 10 minutes walking through their AI robot to finally get to a human being to be told, oh, we're sorry, we still haven't got your orders. You're going to have to call back. And guess what? When I have to call back, I'm going to have to spend 10 minutes going back through that process to get to the scheduler to finally see, did you get my orders so we can get this scheduled? That is not moving engagement in healthcare. That's actually making me more frustrated, and it makes me want to scream because all I want to do, and think about this in particular as we're talking about chronic conditions, right? That you have to get people engaged. And many times, like, I don't want to talk to an AI robot when it comes to my cancer journey. I want to talk to a person. So think about that. AI and analytics enable personalization, but it must move engagement. Trend number 5, trust is the new currency. And we talked about trust in the very first trend, but I'm really bringing it back to say trust hinges on these 3 things: billing, safety, and privacy. Billing, safety, and privacy builds trust with consumers. And what don't we do really well? The number one thing, billing. Consumers want to know, patients want to know, what am I paying for? What is it going to cost me? And again, prime example here in my own personal journey, I will share with you. I thought my insurance was covering everything with my very first oncologist. I was going to a community oncologist before I switched to an academic institution. And at the end of the treatment, after 12 infusion treatments, the financial manager called me and said, "Oh, by the way, you have an outstanding bill of $5,500. And I said, "I have what?" They said, "You have an outstanding bill of $5,500. That was before you met your out-of-pocket. You did pay your deductible, but that's what insurance didn't pay." And I'm like, "How long have you known this? And how long did you not know that insurance is paying for it?" I said, "I am assuming you're going to need to figure out how to write that off." My wife also worked for a hospital system for a few years, so I know some of how this works. But billing builds trust. Safety builds trust. Quality is not safety when it comes to consumers. Let me say that. Quality is not safety. It is actually psychological safety that builds the trust. I must feel safe. Going back to the very first quote, healthcare saved my life, but there were times I didn't feel seen. Psychological safety is paramount to this. And then privacy. Now, what's interesting with privacy, because I am seeing this shift in the market and out there some, is privacy is much more relevant for the 50 and older crowd than it is for the under 50 crowd. And then when you get to the under 30 crowd, privacy is not near as big of a deal. HIPAA is not like, I tell my 17-year-old daughter, please don't share that on your social media. Like, have some common sense of things that you do share and don't share, right? So they share everything in the world. So HIPAA is not as big of an issue for them. So I'm going to stop and let's just look at those 5 trends again. And I'm going to actually pause and let you guys, if there's any burning questions right now. So trust becomes the competitive moat. So transparency, clear communication, and reliable experiences. Care anywhere and everywhere. The digital front door becomes table stakes. Personalization at scale. and trust is the new currency. So I'm just going to look. I don't see any questions in there right now. Anyone have a question that's burning right now? If not, I'll move on to trend number 6. I know it's kind of hard when we're in the webinar sense, but I want to just pause and not throw everything out to you. Any questions at this point?
And it is encouraged. So don't feel like you're slowing
Yes.
us down or anything. This should be interactive.
Thank you, Tiffany.
Or
All
even
right.
a thought, even a
Yeah.
thought, even if it's something that, you didn't think about, or maybe it's something you have always thought about, and Shawn brought it or presented it in a different way. So just any thoughts that you might have.
They're taking it in. All right. Let's go on. Oh, Sandy. Yes. Oh, can you come off of mute, Sandy?
Everything that you're saying makes a great deal of sense. Um, the digital front door, I think many times in systems, they need to really get what you're saying so that they can pivot.
So when I say the digital front door to you, Sandy, or to anyone else, what does that mean to you?
Um, so I'm in the C-suite, and not everybody in my C-suite gets the digital front door. Whether it be the front, whether it be online scheduling, telehealth, uh, first call. Um, we just haven't gotten there. And I know that it's going to take some, I don't know, cajoling, information, shifting to get them there. And so I'd love to hear more about that if it's part of your presentation.
Yeah, you know what? We will definitely. I'll share with you some here. Like, again, remember that my background. I spent 7 years at the Walt Disney Company, and the Walt Disney Company has deeply built an ecosystem, and their whole business is built on this ecosystem. And when I say an ecosystem, I'm talking about the guest digital experience, the vendor's experience, the cast member experience. It's all a strategic strategy, right? And so I remember I was fortunate to work some with Bob Iger at the cruise line. And what we had to remember, especially when we started to enter the digital age even more, because I was there from 2005 to 2012, so that was a big shift. But it's even moving faster now, right? With AI and everything, digital is just. And I tell systems and I tell healthcare organizations, what do you want people, how do you want people to feel when they just walk in your door, right? From, and I even challenge systems to think from, Sandy, from when a patient leaves their house garage door to get to your location to come back to their house door, right? How do you want them to feel? And when they walk in to the waiting room, or they walk into an emergency room, or they walk in to sign, for, any type of diagnostic testing, any of that, how do you want them to feel? If they don't feel that same way when they pick this up and engage with you in the digital experience, then you are not meeting them where they're at. And that's hard.
Excellent.
That's
Thank you.
hard, right? Like, so how do you, you know, um, all of us shop at different places, but those of you that live more in the southeast, Publix grocery stores, right? Consistent experience. They walk in, they make you feel welcome. You'll see that I'm drinking Chick-fil-A, you know, What is the one thing that Chick-fil-A says to you after every interaction? Right.
My pleasure.
My pleasure. Thank you, Mara. Right? Like, and my 17-year-old daughter works at Chick-fil-A. So, um, and if you don't say my pleasure, at some point you get some type of coaching. Because that's the way they want their guests to feel when they come in to the store or they go into the drive-through. And I don't know about you, and I don't know what it is about. Some of you may not be huge Chick-fil-A fans, but I'm telling you, I don't understand why I will sit in a Chick-fil-A drive-through with 30 cars to get my food in that drive-through, but yet if I go to another fast food restaurant and there's 3 cars, I get frustrated. Right? Like it's the way they make you feel. So, hopefully that helps. Sandy and I can touch on it more even. So, any other thoughts? Any more questions? All right, let me go to trend number 6. So, whole person wellness movement. This is where we're going. This is the integration of both physical, mental, and spiritual health. Going back to trend 5 around trust, that psychological safety is huge. So in the mental and spiritual space, and then the physical space. It's actually becoming just an expectation. Like if I don't have those 3 things when I'm with my provider, I will go someplace else. And I know that there is also an attitude because I talk to providers a lot, so I will be upfront and disruptive about this statement, probably. Yes, we have a provider shortage. Yes, we have a clinical shortage, but people still do have options. And telehealth even makes those options greater, right? So I am not going to tolerate not being met with what I want. And I think, honestly, that's probably where my first oncologist got a little upset with me, is because I was dictating my care and what I wanted in my care versus just sitting back and letting him do what he wanted to do. So this integration of whole person wellness, physical, mental, and spiritual health. Trend 7, the consumer data dilemma. Data should be used ethically and transparently. This is a whole, I could talk an hour just on the data dilemma, right? So I mentioned earlier, depending on what generation you are, Gen Xers and older have a real issue with data and where it's getting used and how it's getting used and what it's being used for. Gen Z, Gen Y, Gen Alpha, it's not as big a deal for them. Yes, it is a dilemma. Yes, we have to figure it out. But we have to make sure we're using it ethically and transparently with patients. And you have to know who your population is, what your audience is when you start to use data and how you use it. It is very frustrating to me that here in the United States that we still don't own our own data. When there are countries, I've done some consulting for the United Arab Emirates in Dubai, and they actually carry their data around on what looks like a credit card. And every doctor's appointment, every hospital visit, you give that card to them, and your data from that visit, for that visit, whatever, from that hospitalization, from whatever it is, all the data, all the tests, everything gets uploaded, and you, as the consumer, own your data. So we got to figure this data dilemma out. Experience as a clinical outcome. So patient experience directly affects health outcomes. This was done again in a Barrel Institute study in 2024. That my experience when I'm either virtually or when I'm in your clinic directly affects my health outcome, which is again why trend number 3, care anywhere and care in the home, becomes so important. Outcomes, I believe last year was the first year that in CHIP and STAR ratings where the patient experience is now a majority in some way of the rating and that. So if your patient's not having a good experience, it will directly affect their health outcome. Trend 9, youth are redefining health. So younger generations prioritize wellness and authenticity. And I know some of these trends as we're talking are kind of combining, and there's a purpose for that. Like younger generations, my 17-year-old wants to feel safe again with her doctor and wants to look at the whole experience versus an episodic experience. And start to think about that again with chronic care patients. So many times we treat them as, you have this, you have this, you have this, and we treat it as an episodic condition versus as wellness. So, trend 10, rise of the health consumer collective. Communities online influence health decisions. If you are a leader and you are not out there paying attention to what is being said on social media by influencers, I am challenging you to do it. And let me tell you why. And I'm going to give you a very personal example. I shared this with the last cohort last year. Last year, right after the tragic shooting of Brian Thompson in New York City, my healthcare insurer decided that 12 infusion treatments weren't what was right for me, but they would only approve 8. Although my oncologist said I needed 12. I also know that it's a third-party administrator, someone who probably doesn't have oncology experience making this decision. So if you go out today and you go follow me on LinkedIn, which I hope you all do, I have 117,000 followers on LinkedIn. When I got that denial, I went to my LinkedIn account. I tagged every executive in the C-suite from that major insurance company. I posted my story with a picture of me in the infusion suite, and within an hour, the chief legal officer, and this is one of the big 4 insurance companies, the chief legal officer from that organization called my cell phone and said, "Mr. Nason, what do we do to have to fix this so you'll take your post down?" And I said, "You have to trust my doctor. And my doctor says I need 12 treatments, and you just told me I'm denied my treatment and I'm supposed to start my 9th treatment tomorrow. You need to make sure that it is fixed and that it is approved, and then I will write something about it, but I'm not going to rebuttal what happened because you're making decisions on life and death situations right now." And so influencers are starting to drive decisions in healthcare bigger than we realize. And so this health consumer collective, as we call it, is becoming greater and greater. All right. So the synthesis and implications of this. The trends must be addressed in an integrated way. That's the scary statement and the hard statement when it comes to healthcare. It must be addressed in an integrated way. So what does that mean? That means that you have to look, and that's why so many of the trends had same words and same concepts. So you have to design for humans, not just for healthcare. So I'm going to ask you this question, two questions here, and this is where we get a little bit more interactive and start to talk. Which trends in your organization are you most prepared for? And which are you avoiding? Now, I'm going to put all list of 10 of them here in a second, but think about those two questions. Which trends are you most prepared for, and which are you avoiding? Trend 1, trust becomes a competitive moat. Care anywhere and everywhere. Trend number 2. Trend number 3, digital front door becomes table stakes. Number 4, personalization at scale. Number 5, trust is the new currency. 6, whole person wellness movement. 7, the consumer data dilemma. 8, experience is a clinical outcome. 9, youth redefining health. And 10, rise of the health consumer collective. Which of these trends are you most prepared for? And which one either scares you or you would like to avoid? So, I'm going to ask you to raise your hand, come on camera, and share with the group as we think about these trends. What are you most prepared for? And which one would you like to avoid? Or you can put it in the chat. Oh, oh, I see it coming here. Oh, I can make the image bigger. Give me just a second. Is that better?
Yes,
Awesome.
wonderful. Thank you, Shawn.
Yes.
Yes. Sorry about that. I didn't realize that. So who's going to be the brave one to start first here? Of which do you feel you're the most prepared for, and then which one you want to avoid?
I'll start since they seem to be afraid. No, I'm just kidding. All it takes is one to get it started, so I'll be that person. So I think that we are probably most prepared for trend number 2, care anywhere and everywhere. And so we're speaking from an organization, what I think is.
Yeah, organization or personally.
Okay. I think that we still have a lot of work to do. In general, in number 5, a whole lot of work to do. In that aspect, I think there's a thought that we should give consumers that at the minimum of what they need. You know, like they're having an appointment, this is the information they need, or they've just had an appointment, this is the information that they need. When in reality, we should be thinking like trend number 7, when let's give it all to them, or let's give as much as possible, to them and help them navigate what that data means. So I think as an organization or as organizations, I can't speak for UMMC, but just my experience as a consumer. I feel like the number 7 is still a big issue because even having my chart sometimes, or even I'm gonna say patient portals, let me say that patient portals sometimes give a false sense of transparency. But when I go in there, I'm like, this is not everything that just happened, or I know this is not all of my mom's test results because they still have to be released by someone. So those are the things I have thoughts about. I see Evelyn has her hand raised.
Yes.
Yay!
And I will say this to you, Tierney, with the number 7 and around that, like, right? So think about this when you're dealing with chronic condition, again, patients. And I'll share from my personal experience, going through cancer now, over the last 4 years. I will see my test results before my oncologist will, because it's uploaded in my chart and I read them. And as you guys know, those test results are in languages that most patients can't even understand. But you can learn to identify the good or the bad in those tests, right? And so, yeah, that's where we have to figure out this consumer data dilemma. So, Evelyn.
Hi. So, in my mind, number item number 8 and number 10 are kind of similar in a sense. And I would say that's probably where we are as an organization the most prepared, only because this has really been, I think, a trend that is not a new, really philosophical or principle way of approaching medicine. We increasingly are providing care that envisions the patient from the lens of a consumer. Have we done it well? I would like to believe that we at least are aware of the need to make sure that we more readily stand that consumer experience or the patient experience as a consumer experience as well. So 8 and 10, I feel like are kind of similar in a way. I would say none of these that I would say we're not prepared for. Do we do? I think maybe number 3 is what I find to be the most challenging. And if by digital front door, or the conversation there is around all the technologies, then so if 8 and 10 recognize patient as a consumer, 3 is execution, and the execution is increasingly more complex, more nuanced. AI, the ability to make sure that all our patients slash consumers also have, traditionally our conversation is always around health literacy, but now to be able to do 3 effectively, you also need a certain level of literacy, technological literacy in your consumer. And so you might have a strategy around execution, but if your audience is not necessarily there or has a different sense of what might resonate with them, then your number 3 becomes a little bit clunky if not done well. So ready for 8 and 9, understand 3 to be future facing. Ready for, I would not say we're shying away from any of these, but recognize 3 as probably the biggest stretch and growth area.
Awesome. Thanks for sharing so much. And I'm glad to hear that 8 and 10 that you guys are really moving forward. That makes me happy as a patient. So thanks for sharing. Jeff.
Yeah, and this is a great exercise. I think from our organization standpoint, we're probably most equipped, like Tierney, for trend number 2. I think technology has made this possible where we can really deliver care to a patient how, when, and where they need it, and being able to, meet them where they are. They would say the one where maybe not that we're avoiding, but on the flip side, trend number 4, personalization at scale. We have all of these ways to deliver care to patients but we don't have a way to understand, what is that patient's preference. So me personally, I don't ever want to go into a bank. And so, I interact with the, banking application on my phone, etc. I can set my personalization or my preferences, so that I can, interact with that service in the way that I want to. There's not really a way to do that, at least within our tools, from an Epic or MyChart standpoint, to say, I as a patient want to interact with my health system virtually, and I want to see all of the virtual options first. I have to go through a decision tree and, 5 different pathways before I even get to the virtual option. And it just seems like we're not meeting those preferences of the patient and allowing those tools to be the most effective by, taking those preferences into account.
And I love that, Jeff. And this is a great conversation I have with, leaders all the time. And we talk, right? Like, how easy would it be in an Epic or, a Cerner, like in one of those, to just put that, like, when it comes to certain parts of my care journey, going through cancer, yes, some of it I am completely fine doing without talking to a human being. But it would be great if we could just take the patient journey and lay it out and say, I want to talk digitally here. I want to talk to a human here, right? You know, don't show me my test results. Do show me like all of that. So then, I'm in a couple groups. You'll hear this terminology, and some of you might have gone through this, around scanxiety instead of anxiety, scanxiety, right? So many cancer patients deal with scanxiety because before we go in for our next scan, what's going to happen? You get all of this. Like, how can we prep that in such a way in the personalization? And it's one of those things that I think, Jeff, holy cow, this isn't that hard. Like, you can build a whole data system. Why can't we just build a great personalization too? So, thanks for sharing that. Anyone else want to share? So quiet. I like.
I see Sandy put something in the chat.
Oh,
She said least prepared for them is a digital front door, and most prepared experience as a clinical outcome.
yeah, right. Um, uh, I love that. And I think the digital front door things for many organizations is just, we have in healthcare, we have tried to get as far as we can on the least amount of dollars when it comes to the digital experience. But yet everything else is all done. The rest of our life is done in such a way. So, what I would like to ask as the last question before we go into the second part of the webinar and some learning activity for you over the next month, as I'll walk you through that. How many of you guys, and I'd love for a couple of you to speak up about this, how many of you guys are using either AI effectively, or on the other side of it, feel like you're not using AI effectively? Or you can say, we're not even looking at AI. Evelyn.
I'm not sure where there's no, that's a difficult question and a difficult answer, right? So effective would assume proficiency. And I, as I have conversations with my team members, is I feel like we're really in this inflection point where nobody has a benchmark. So to say we're using it effectively, I don't know if anybody could really truly speak to that, because there's such a rapid evolution and change, and everybody's just trying to find their space. So I think maybe to me, if would just be, are you even trying? You have to start somewhere. And so to me, that maybe the success is that you're at least trying to integrate it into your day-to-day. And then the layers are, okay, let's move a little bit beyond some of the quick and easy. Do you have a 1 year, 3 year, 5 year strategy? And do you have a reference point and a target of where you want to be? So I couldn't answer that for you today. I know that one of the things that I say is I just encourage everybody to at least have a level of self-awareness and make sure you're dabbling. And I tell all this to every leader that I work with, is everything that you thought made you a leader and was a strong point we have an ability now where there's like a level set in at least presentation, maybe not necessarily in heavy content, but at least in the initial first glance, everybody looks, everybody can look about the same, and it is not until there's a little bit more depth that you realize what one person knows versus the other. But the tools that we have right now is really leveling the playing field. For me then, in terms of what does the patient see, my organization is in the process of transitioning from one EMR to another, or actually we're going from Cerner to Epic, a lot more AI tools in Epic. That is a learning curve for us. And so this is probably something that I would be better able to answer maybe in like a 12-month look back of, once we go live, are we utilizing all these tools, or do we have all these efficiencies and we're still using Epic like we used Cerner? So that's my thought.
Thank you, Evelyn. Tierney.
Yes, I just have one statement. I won't prolong the time, but Evelyn, you said something that I guess what the gist of what you're saying is something we do need to bring up now, even in this boot camp, as we work through these issues, as we identify our problems and then hopefully come up with some solutions, is that there is not a one size fits all. Several of you today could have said we're not using AI effectively, and you could be doing exactly the same thing as someone who says that they are using AI effectively. So it's important that your organization understands why you're using AI in the way that you are using it. It makes me think about establishing metrics, for a program. Is if you don't really take the time to identify metrics that measure your why you did this in the first place, someone else could come along and evaluate your program and say you did a horrible job, when what they're measuring you against is not what you set out to do in the first place. How we can create a program and say, oh, we only had 25 patients to use that service, and we say it's a flop because we have a pool of 1,000 patients, right? But if your goal was to target your highest risk patients, or let's say it's cancer patients, and one thing you did could have saved, that person's life, the impact is different. The impact is not always numbers. So I mentioned that as far as this program is, as you are thinking about your organizations, or maybe it's a fictional organization that can create, that your goals for whatever chronic disease management program you choose may be the same program, but your goals for your organization may be different. The why you chose to do remote patient monitoring, the why you chose to do, TCM, the why you chose to do APCM may be very different. So when Evelyn said that about the moment of self-reflection and all of that, You really do have to think of it like this is what is happening in the industry, but this is why my organization is doing this. This is what we're trying to achieve. And really think about that from that kind of perspective. So I think that was a good segue, into some of the things we're going to talk about. So thank you. And thank y'all for the interaction.
Yes. Yes. Any other thoughts around AI? I did see not using it effectively. Yeah, I mean it's a hard one. But I will tell you this, I attend the Consumer Electronics Show every year in Las Vegas the first week in January. And AI is no longer considered a tool. AI is just here. And that's a real mind shift for organizations. So if you're looking at AI as a tool, I would challenge you to think about, no, it's just another, for lack of better, it's just another seat at the table that you need to figure out because it is not going away. It is actually rapidly growing and changing every day. And so how we use it in healthcare and in organizations is really, really important.